Not only do I encourage you to become a certified medical coder, I'm all about being marketable as well. That means expanding your knowledge base as it relates to the whys behind the coding guidelines that you learn and follow. Did you know that some of this information comes from Congress? Well, it does. They are responsible for the bills and laws that are directly related to our profession. While we don't lobby, we can advocate. Let's chat about it. Hey there, and welcome. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've transformed hundreds of students to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. Last week, I represented my state of Ohio in the AHIMA Advocacy Summit. It was a bit different. It was an entire virtual experience, and it was actually a great experience. There were also virtual education sessions before and after the congressional meetings. The sessions included accelerating digital health public policy, congressional priorities in the 117th Congress, enhancing affordability and health information for individuals, and an update from the Office of Civil Rights, or OCR, on removing barriers to coordinated care and healthcare transformation. This year, the summit was open not only to the CSA advocates, but to any member at large. It was refreshing to meet others in Ohio who are also passionate about advocacy. There were over 220 congressional meetings with House and Senate offices. Unfortunately, this year I was unable to meet the congressmen personally, but their staff graciously stepped in and listened to our issues. Over the course of the 2 days, I met with 3 staff members who work with Ohio Congressman Representative Steve Chabot, Senator Sherrod Brown, and Senator Rob Portman. This year, we discussed the following bills: H.R. 366, Protecting Access to Post-COVID-19 Telehealth Act of 2021. The Protecting Access to Post-COVID-19 Telehealth Act of 2021 would ensure expanded use of telehealth after the coronavirus public health emergency by eliminating restrictions on the use of telehealth in Medicare and requiring a study on its use during the pandemic. The bill would eliminate most telehealth geographic and originating site restrictions under Medicare and establish the patient's home as an eligible distance site so patients can receive telehealth care at home. Prevent a sudden loss of telehealth services for Medicare beneficiaries by authorizing the Centers for Medicare and Medicaid Services, CMS, to continue reimbursement for telehealth for 90 days beyond the end of the public health emergency. Make permanent the disaster waiver authority, enabling the U.S. Department of Health and Human Services, or HHS, to expand telehealth in Medicare during future emergencies and disasters, and require a study on the use of telehealth during COVID, including its costs, increased utilization rates, measurable health outcomes, and racial and geographic disparities. Next is House Bill S674, Public Health Infrastructure Saves Lives Act or FISLA is what I call it, the Public Health Infrastructure Saves Lives Act, would create a core public health infrastructure program at the Centers for Disease Control and Prevention, or CDC, to modernize public health at every level. Under FISLA, state, tribal, territorial, and local health departments would receive sustained funding to address the foundational capabilities of public health, a core set of activities and measures that ensure they have the tools, workforce, and systems in place to address existing and emerging health threats. Funding for the program would be aimed at addressing core public health infrastructure, including assessment, which also includes surveillance, epidemiology, and laboratory capacity, all hazards preparedness and response, policy development and support, communications with the public, community partnership development, organizational competencies, leadership and governance, accountability and performance management, including quality improvement, information technology, HR, financial management, and law. Also equity. Lastly, bipartisan bill S-104 and HR 379, the Improving Social Determinants of Health Act of 2021. The Improving Social Determinants of Health Act would authorize the CDC to create a program to improve health outcomes and reduce health inequities by coordinating CDC social determinants of health related activities and improving the capacity of public health agencies and community organizations to address social determinants. The program would coordinate across CDC to ensure programs consider and incorporate social determinants in grants and activities, award grants state, local, territorial, and tribal health agencies and organizations to address social determinants in target communities, award grants to nonprofit organizations and institutions of higher education to conduct research on social determinants of health, best practices, provide technical assistance to community grantees, and disseminate best practices, coordinate, support, and align social determinant of health related activities at the CDC with other federal agencies such as the Centers for Medicare and Medicaid Services, and collect and analyze data related to the social determinant of health activities. So you see, we had a full agenda with some heavy hitting issues. Now, just because you didn't attend the Advocacy Summit does not mean you can't advocate. We talked about AHIMA's naming pledge, and it's a whole competition now. All states are competing to get the most participation, and I'm asking you to join me in taking the pledge. I talked about it all in this video here. You can check it out here. And you can also find the links to both the video and the pledge in the description box below. Remember, advocate means to plead the cause of another, and we probably do that every single day. So again, thank you in advance for advocating for the health information profession. You have learned about the Great AHIMA Advocacy Summit of 2021, and you have also learned about the various House bills that AHIMA weighed in on. And lastly, you have learned that you still have time to advocate and take the naming pledge. Questions of the day. Was this information helpful for you? Also, did you learn something that you can apply? Have you taken the naming pledge? Let me know your responses in the comments below. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified, marketable medical coder. Learn more at bit.ly/5stepscoder. If you liked the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment or asking a question. You can also give me a little love by sharing this video on your social media platforms. Tag me in your video share at PRNcodingEDU. Let's stay connected and connect others. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and thanks for watching.